Hello everyone, welcome you all to the fourth free session of Movement Maestro Academy. Lots of free learning resources are there in our channel, so must subscribe and keep learning with us. For today's session, we have one of our enthusiast and dynamic lady, Zila Habib, is there who is just continuing their intensive program right now. Today we are going to discuss on the topic osteoarthritis. Without wasting our time, let's start the today's session. Over to you, Zila.
Good evening, everyone. First of all, I would like to thank you, Dr. Pradyut sir, for giving me an opportunity to share my knowledge and to share my views with you people. So let's start today's topic. That's osteoarthritis. As you all know, osteoarthritis is described as a wear and tear disease. It's often described as non-inflammatory disease or degenerative disease. But nowadays, it has been reported that inflammation also plays some role in case of osteoarthritis. It's most commonly degenerative disease that it occurs due to the normal degenerative process that occurs in aged persons due to aging. But it has been reported that all many other causes are also responsible for the osteoarthritis, like being obese, being female, your occupation, and some other factors are also responsible for the osteoarthritis. Now, osteoarthritis most commonly occurs in the synovial joints. As you all know, the synovial joints are a type of joints where there are two articular surfaces, and the two articular surfaces are separated from each other by means of articular cartilage. This articular cartilage is a type of disc. It's a type of connective tissue that allows the two bones, or that allows the two articular surfaces to glide against each other with minimal friction, or we can say without any friction. But if somehow this mechanism is disturbed, for example, in case of osteoarthritis, then what happens, these two articular surfaces come close to each other. This articular cartilage is destroyed, and as a result of this, the space between the two articular surfaces gets decreased, and this friction automatically increases. Osteoarthritis occurs due to the combination of three factors. First one is the genetic factor or the genetic causes. Second one is overuse of a specific joint. And third one is injury or trauma to the specific joint. It's thought that the osteoarthritis develops or occurs due to the imbalance between the cartilage being worn down and the chondrocytes repairing the cartilage. So this results in to the structural change in case of joints. And these structural changes are quite visible on the X-ray. Now, what are the various risk factors for the osteoarthritis? The first and the foremost risk factor is the obesity. Being obese means you're putting more load on your joints, especially your weight-bearing joints, like your knee, which is more prone to osteoarthritis. Then the second risk factor is your age. If you're above 45 years of age, it means you're prone to osteoarthritis, because after 40, your degeneration process starts. Then the third cause is occupation, especially those occupations where you put more stress on your specific joints. Next, being female is another cause, because you are having vitamin D deficiency, calcium deficiency. So being a female is also a risk factor. Now, as I discussed earlier, trauma or injury to any specific joints also leads to osteoarthritis. And the family history of osteoarthritis is also the risk factor. Now, as I already discussed in the previous line, that this osteoarthritis, in case of osteoarthritis, there are specific structural changes that occur in that specific osteoarthritic joints. Now, let's see what are the most common X-ray changes found in case of osteoarthritis. Mostly four types of changes are found in an X-ray. That is, we can remember it with the mnemonic LOSS, LOSS. The L stands for loss of joint space. That is, the space between the two articular surfaces gets decreases. As the space gets decreases, the friction between the articular surfaces increases, which leads to pain. Then O means osteo. I can also share screen with you. Only the host ends. So allow me to share the screen. So there are four key axis chains in case of osteoarthritis. That's loss, L-O-S-S. The first one is L, and L stands for loss of joint space. Means the space between the two articular surfaces gets decreased. As the space gets decreased, the friction between the articular surfaces gets increased, which leads to the pain. Then next is O. O means osteophytes. So in case of osteophytes, there is in case of osteoarthritis, there is osteophyte formation. Osteophytes are the bony spur. We can say these are small bony outgrowths. If these bony outgrowths are formed, it's these bony outgrowths or osteophytes that impinge and cause pain while walking, while sitting cross-legged, or while climbing the stairs. Then S means subarticular sclerosis. Subarticular sclerosis means the joint density along the joint line, bone density along the joint line gets increased. Then the second S means subchondral cysts. Subchondral cysts means there is formation of fluid-filled cavities or fluid-filled holes, which we call as geodes. Now, it should be noted that it's not necessary that X-ray chains should correlate with the symptoms. It has been found that in some cases, specific or significant change might be found incidentally in someone without symptoms. Or equally, someone with severe symptoms of osteoarthritis may only have mild change on an X-ray. You can also see in the picture, this is an osteoarthritic joint. Here, this is the these are the two articular surfaces, and in between the two articular surfaces, there is narrowing of the space. That's loss of joint space. And this is osteophyte formation. These small holes suggest these are subchondral cysts, and this is the subarticular sclerosis. That is increased bone density along the joint line. Now, after that presentation of osteoarthritis, the patient of osteoarthritis presents to you with two major symptoms, the pain and the stiffness in that specific joints. This pain and stiffness, it should be noted that this pain and stiffness is always activity related. That's it worsens with the activity. Whenever you do any activity, it gets worsened. In contrast to any inflammatory or rheumatoid arthritis, wherein the activity decreases the pain. Osteoarthritis also leads to deformity, instability, and reduced function in the joint space. Okay, now which joints are commonly affected in case of osteoarthritis? The most commonest joints affected by osteoarthritis are first knee joint and the second hip joint. Other joints affected by osteoarthritis include sacroiliac joint, distal interphalangeal joints in hands, carpometacarpal joints at the base of the thumb, the wrist, and the cervical spine. Now, there are various signs of osteoarthritis, which depends upon which of your joint is affected. For example, if your hand is affected, if you are having osteoarthritis of hands, then there is formation of Haberdon's nodules in the DIP joints, Bouchard's nodes in the PIP joints. There is scarring at the base of the thumb of first metacarpal joint, weak grip, or reduced range of motion. Most often in case of hands, your scapometacarpal joint is involved. Why? Because it's a saddle joint, and during day-to-day activities, it gets a lot of use. So this makes it more prone to wear and tear. Other joints are like your knee joint is involved. If your knee joint is affected, you will be having restricted movements, enable you to climb the stairs up and down. Uh, there will be crepitus, etc. Now, diagnosis. NICE in 2014 suggested that the diagnosis can be made without any investigation if following three conditions are satisfied. The first, that patient is over 45. Second condition is that there is typical activity related pain, that is, activity worsens the pain. And third, there is no morning stiffness, or there is stiffness, there is morning stiffness, but that lasts only less than 30 minutes. Now, at last, there is management. The management of osteoarthritis always starts with the patient education about the condition and advice on the lifestyle change. Like if the patient is obese, he's advised for weight loss in order to decrease load on the particular joint. He's advised for physiotherapy so as to improve the strength to support the joint. He's advised for occupational therapy and orthotics in order to support activities and functions. After that, after lifestyle change, we prescribe stepwise analgesia in order to control the symptoms. The first line of drug is the oral paracetamol and topical NSAIDs. Second line of drugs is we prescribe now oral NSAIDs. Plus, in addition, we prescribe proton pump inhibitors so as to protect the stomach. The third line drug is the opiates like codeine or morphine. In some cases, we also give intra-articular injections, as intra-articular injection of corticosteroid provides temporary reduction in the inflammation and improves the symptoms. The last treatment is the joint replacement. It's only done in severe cases. Most commonly, hip and knee joints are replaced. And physiotherapy is having a lot of role in case of osteoarthritis. For example, if some osteoarthritic patient comes to you, we will give him a hot pack or cryo according to severity. For example, in case of acute cases, we go for cryotherapy, whereas in case of chronic cases, we go for hot therapy or hot pack. After that, in order to break the adhesions, in order to relieve the swelling, we give ultrasound. After that, for pain, for subsiding the pain, we give TENS. And after that, isometric exercises, especially in case of knees, we go for McConnell's exercise program, or accordingly, we'll prescribe the exercise. Thank you so much. Over to you, sir.
Thank you so much for this informative session, Zila. Thank you everyone for joining. Just let me explain shortly about the summary of osteoarthritis to evolve. As everyone knows, osteoarthritis is the most common form of arthritis. Some people call it degenerative joint disease or wear and tear arthritis. It occurs most frequently in the hands, hips, and knees. Okay. With osteoarthritis, the cartilage within a joint begin to break down and the underlying bone begins to change. These changes usually develop slowly and get worse over time. Osteoarthritis can cause pain, stiffness, and swelling. In some cases, it also causes reduced function, disability. Some people are no longer able to do their daily living activities or daily works, right? So, just like that, common signs and symptoms are like pain, stiffness, decreasing range of motion gradually, swelling are also there in chronic cases or prolonged cases, right? Okay. So normally how to diagnose this? We can physically observe, or we can also diagnose through the X-ray and all. And treatment protocols are vast. As we know, we are the physiotherapists, so our treatment protocols are in various sources, so we can treat an osteoarthritis condition in various ways. Okay, for now, in various advanced techniques are also there for the management of osteoarthritis. But what the most helpful thing? Increasing physical activity, it will prevent the joints before the degeneration started, right? Physical therapy also likes muscle strengthening, various self exercises we can perform to prevent as well as to manage the joint structures. Weight is the most important thing. If the weight will be higher or if the weight is heavy, then the complete body weight is transmit to the knee. So what happens? The more wear and tears occur between the joints. Okay, lots of things are there. If more chronic stage it will goes, then it will be difficult to cure by performing the physical therapy. So it will be treated by the surgery. So these are all about the osteoarthritis. Very briefly and informatively, Ms. Zila have described that. So thank you everyone. Thank you all for joining. Thank you, Zila Habib.